In this video, we are going to address the number one movement that you need to unlearn right away in order to effectively avoid blowing your lumbar disc out. And if you've got a lower back problem, avoid making it worse in the first place. We're going to talk about the little thing on the board behind me. We're going to talk about the discs. We're going to talk about what is happening when you're doing this movement. And more importantly, because each one of our videos, we want to make sure they've got value for you, we're going to be addressing what you should be doing instead towards the back end of this video. Don't skip the early part because that's helping you understand why. You can watch all these videos on YouTube and you can see do this, do that, do that. And often you just go ahead with it mindlessly, not necessarily knowing exactly why we should be doing these things and in what circumstances we should be doing these things. So we do these videos to try and give you that education, that understanding of why you need to do this rather than just say do this because I'm smart. The majority of disc injuries in the lower back and incidentally in the neck as well are going to go straight back off to one side or the other. They're not going forward, they're going backwards. And because of peculiarities in the way in which our lumbar spine has its supporting ligaments, they tend to go off to the left or to the right as they go backwards. And we'll go through a little bit on the board in a moment to just talk about this in more detail. And that's why we get symptoms going down one leg or the other. But we need to understand why that is. And it comes back to this movement that we're going to be talking about. So just to give you a very simple pictorial representation of what's going on, we've got your disc as we're looking down on the top of the head or through the body, head here, feet inside the board, and we've got the disc here. Now the disc has a bunch of rings around it, which are the annulus fibrosus, and we've got the nucleus pulposus, the gel bit, or the jam inside the donut, as we like to think of it. We've got the front part of the body here, we've got the back part of the body here, your spine sitting just behind here, or the back part of the spine, the pointy bit that we can feel from the skin. And what's happening is as we drive down on the front part of here, we drive the disc backwards. This is why most of these disc injuries go backwards, because of driving down on the front. If, however, we were to drive down on the back part of the disc, there are a number of reasons why that's going to be more difficult, mainly because we have facet joints on the back, and we'll talk about that with the spine in a moment. But most of these injuries are driving down on the front, and they're driving the fluid backwards or off to one side. Just going back to why these disc injuries go backwards instead of forwards and the difficulty of making the disc material drive forwards is that the structure of the spine, we were in that picture behind me talking about the disc which is on the front here. The back portion, we've got the facet joints. Now they're going to meet one another long before we actually get significant compression through the back part of the disc. So hopefully that makes that bit make a little bit more sense. Now we've just shown you on the spine, but that should really make sense as to why we don't tend to get these disc injuries coming forwards, because we can't exert enough compression on the back before the facets get involved and they prevent the disc from being compressed as much back here. It's that one movement, or those mix of that one movements, that actually cause the compression through the front of this disc, driving the material backwards in some direction. And let's show that movement right now. So those sorts of movements are the sorts of movements where we are bending very badly. We're bending all with the lumbar spine. And the reason that we tend to make this worse is not only is that forward bending actually exerting compression on the front part of the disc that we saw earlier, we're also generally accompanying that forward bending with exertion, physical exertion. Now that could be you yanking your socks on. It could be you picking something up from that position. It could be you slightly twisted as well, hence why it often goes to the left or right as well. It could be you trying to wrestle that child seat into the car, ready for you to pop your toddler in. It could be all those different things, but they all involve that forward bending with, to a certain degree of left and right, with that compression. And that is why these movements, or this specific movement with those nuances, is so very bad for those lumbar spine issues. So knowing what we've just done, we've taken the front part of that disc and we've compressed through it, driving that fluid straight through the back of the disc to create the strain, the herniation, the bulge, whatever severity it may be. Why on earth would we be doing any forward bending, any more forward bending? Knee hugs, for example, touching our toes, for example. These would be the worst possible thing we could do, because all we're doing is reinforcing that same squashing movement again and again and again. Now, unfortunately, those sorts of exercises and movements tend to be prescribed quite a lot. We've got a video that we'll link to up here that you can read more or watch more about those specific movements and why they're not necessarily a good idea right now. But hopefully that will really broaden your understanding of this particular video and it'll tie in really nicely. As you've probably seen by those examples we mentioned earlier of this movement in action, it is something that is unavoidable. And that's why you need to unlearn that bad bend, unlearn that bend from the lumbar spine, unlearn that forward bend that helps you round like a prawn. Instead, we want to do the right sort of bend, and that is the hip hinge. We'll get more onto the hip hinge in a moment because it is really a fantastic movement. But just take the time to actually reflect while you're watching this video. If you're someone that has got a back injury, whether it's with sciatica, whether it's a disc bulge herniation or some amalgamation of that, maybe even it's just degenerative disc disease, so that's cumulatively over the years, just think about how many times a day you're doing this bad movement. And it's repetitive. And if you're not made aware of it and aware of the problems of that movement, it's no wonder your back pain doesn't resolve. It's no wonder you don't get better, or no wonder you're plagued with setbacks along the way, because this inability to move correctly in the lumbar spine and learn to bend properly is something that will have been there for so long before you injured your back, contributing to the setting in of those bad habits over and over the years prior to injuring the back. And then they just stay there. They don't go away once you've injured the back. You continue to do them. And that's where people can really get caught up, which is why we've done this video in the first place, to hopefully bring your attention to something that you do probably without a second thought at all. You just go down, put that sock on. You go down, pick that thing off the floor, move that out the dishwasher with that nice rounded back, and it's not helping. So more onto the solution, the hip hinge. And this is just the foundation, because the hip hinge, once you can move properly from the hips and you can keep your lumbar spine in a sensible, safe, neutral position, equalize pressure through those discs, not pre-stressing any particular fibers, especially those on the back of the disc like we showed you earlier, you're going to be able to integrate that hip hinge with squats, etc. Because some people, unfortunately, when they start doing squats, they don't have the ability to do the hip hinge. So they do the squat, but they're not bending from the right points and they're not keeping static strength in the wrong points. So hopefully this video has given you a bit of food for thought, thinking about how you're moving, thinking about ditching that bad bend and in favor employing a hip hinge. And we've got videos all over the place on how to do hip hinge and how to do it correctly. And hopefully this video has helped you understand why it is an important thing to master. It does take a bit of time. You're going to have tension in different areas. Different muscles are going to limit different parts of the range of motion. But as you learn to do it slowly and carefully in a controlled environment, you're going to start to be able to apply it to your day-to-day movements, your day-to-day life, whether it's getting up out of bed in the morning without rounding the back, whether it's getting into the dining chair, whether it's getting out the car seat. You'll learn to start to engage supporting, stabilizing muscles that maintain a good lumbar lordosis and bend from the hips. Get those powerful glutes, those powerful leg muscles, hamstrings, quads, etc. involved in driving that movement from A to B. And that will put you in a much better stead, not only for the future, but also from a recovery point of view in terms of getting over this back pain and avoiding injuring your discs any further. Hopefully you found this video helpful. If you did, please consider giving it a like, giving it a thumbs up, and consider subscribing to the channel and sharing this with someone that you know that might benefit from this video. Maybe you've got a friend that bends in a bit of an inappropriate manner and it always makes you kind of squeamish when you see them picking something up off the floor. Hopefully you can send them this and have them avoid getting into a bit of trouble. They can unlearn that bad movement and learn that hip hinge sooner rather than later. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.